Hi, Keith. Nice to see
Nice to see you too. It seems like we're the early birds here.
you. Is it still like 5 minutes?
Yes, that's true. It looks like a list of luminaries. Hey, Gail.
Hello, everyone.
Hi, Gail.
I noticed that Dr. Keith and Dr. Ziad have tested their microphones, so I thought I might do too. My name is Mike Davis from the United Kingdom. I'll be joining in with the speaking. I think I'm last on, but I can see one or two smiles there, so that must mean that my microphone's working. Cool. I'll go back on mute.
Good morning, everyone. This is Amit Rawal. I'm tuning in from Gainesville, Florida in the United States. Can everybody hear me okay?
Yes, we can.
Okay, fantastic. I'm excited to be here. Thank you for having me.
Testing 1, 2, 3. This is the moderator. Can you hear me? Good. And our expert interpreters are also giving the thumbs up. For those of you who are just tuning in now, just a piece of housekeeping, you will be able to have interpretation. Look on your screens, and at the bottom, there's a button for interpretation. There should be anyways, and you can select your language. We have the full suite of UN languages available today: English, French, Russian, Spanish, Chinese. Yes, the full suite. Welcome everyone who's online already. We're just going to give a couple more minutes for more people to tune in. We're ready to start though, so it won't be long. Thank you for joining us.
Recording in progress.
Good morning, good afternoon, and good evening, and welcome to the launch of Defeating Meningitis by 2030, a global roadmap. My name is Nika Alexander. I'm part of the communications team here at the World Health Organization. Meningitis is fatal and debilitating, striking fast with serious health, economic, and social consequences, including lifelong disabilities. It affects people of all ages in all countries. For the first time, countries have collectively resolved to end suffering from this disease, expanding access to prevention, treatment, and support for those affected. Ending meningitis is within reach. Today, you'll hear from country representatives, implementing partners, and those personally affected by meningitis. To get us started, it is my distinct privilege to welcome Dr. Tedros Adhanom Ghebreyesus, Director General of the World Health Organization, to formally open this event via a video address. Let's listen.
Dear colleagues and friends, meningitis kills 250,000 people each year, leaving 1 in 5 of those it strikes with long-term devastating consequences. Global efforts against meningitis have lagged behind other vaccine-preventable diseases for far too long. We already have many of the tools we need. The challenge is to make them available, accessible, and affordable, while fostering innovation to complete this arsenal of tools. In November 2020, the World Health Assembly adopted the first resolution on meningitis prevention and control, and approved the global roadmap to defeat meningitis by 2030. With our partners, WHO has developed a global strategy to defeat meningitis by 2030, including a vision and roadmap for preventing, diagnosing, and treating meningitis, and providing care for those affected by meningitis who live with disabilities. The roadmap is an operational document with clear priorities, activities, and milestones in several areas, and a concrete plan. If implemented, the roadmap will have benefits beyond meningitis control by strengthening immunization programs, global health security, access to disability support, and primary health care. The COVID-19 pandemic is a demonstration of the world's ability to respond to global health threats with innovation and determination. With the same innovation and determination, defeating meningitis is within our reach. Let's act now.
We thank Dr. Tedros for his leadership in the fight against the disease. We are now going to transition to our first panel entitled, "What is the Impact of Meningitis Today?" The impact of meningitis is as profound as it is diverse. It can kill within hours. It disrupts health systems. It impedes education and child development. It devastates families and communities, and it can cause lifelong disabilities. Meningitis epidemics are unpredictable and can strike anywhere, affecting people of any age, including healthy children and young adults. Our speakers in this first panel are a diverse group of individuals with an array of firsthand meningitis experience. To begin with, I'd like to introduce Dr. Amit Rawal, a meningitis advocate and champion who has a close personal history with meningitis. Dr. Rawal is the founder of the Avni Foundation, named in honor of his daughter, Avni. Dr. Rawal, it is an honor to have you with us today. Welcome, and over to you.
Thank you. Thank you so very much for having me. And a big thank you to all, from the World Health Organization and today's presenters, to the healthcare organization, leaders, policy experts, and other health advocates. And of course, a big thank you to all the meningitis organizations and meningitis champions all around the globe. You know, it's hard. It's hard and emotional when you tell people that we have 2 children at home, and yet we had a 3rd child who isn't at home any longer. But that child is still a huge part of our journey as a family. Avni was our first daughter. She was born on May 6th of 2013. And wow, what a wonderful day. I mean, not only our first child, but that day was also my wife Melissa's birthday as well. And in that moment, how lucky is that? And while life was wonderful for those first 5.5 months, what happened next, it's still difficult to comprehend. In October of 2013, Avni woke up in the early morning with a fever. Now, I looked at Avni not only through the eyes of a concerned parent, but also through the eyes of an emergency medicine physician as well. And everything was reassuring. Her fever was responding well to medication. She was smiling, interactive, happy. I mean, she was our daughter. But a few minutes later, that's when I noticed the first spot of a rash, and we froze. I knew she could become very sick very quick. It's devastating to walk into the hospital with your normal baby girl who, despite the fact that she has a fever, she's still looking around and smiling and cooing, to the point within 2 hours later, the rash has taken over her whole body. She started to have seizures. She required a breathing tube and intensive care. And unbelievably, 15 hours from the first sign of anything being wrong, the first sign of any fever, we lost her. She was gone. Meningococcal bacterial meningitis. Meningococcal serogroup B meningitis. Now, there are an estimated 2.5 million annual cases of bacterial meningitis worldwide. And that causes an upward of over 250,000 deaths every year. And the lucky ones, the survivors, hundreds of thousands each year are left with brain damage, amputations of arms, legs, hearing loss, seizures, and other conditions. On the public health side, bacterial meningitis causes unpredictable epidemics, leading to chaotic upheaval in communities and in health systems. For the families who have lost a loved one to this illness, many suffer lasting issues with mental health and well-being, as you can imagine. And that's witnessed by the fact that over 80% of parental households are eventually broken up after the loss of a child. So finally, some good news. Effective vaccines are now available to protect against the 4 main causes of bacterial meningitis. Now, the loss of life and suffering is needless and it's preventable. And these vaccines will not just prevent meningitis, but all forms of blood infection and other debilitating conditions that are caused by these same 4 bacteria. On a personal note, we created the Avni Foundation to educate, advocate, and ultimately vaccinate so that others may be protected from what is now a vaccine-preventable illness. And today, I'm thrilled. I'm thrilled as the World Health Organization has unveiled the roadmap to defeat meningitis by 2030. A challenging but attainable goal. We will need passionate and sustained leadership. We will require support and resource from healthcare and philanthropic organizations, policymakers, meningitis advocates, and many others joining together. And together, we can implement this roadmap to save millions of lives by 2030.